until such time as we do get to that peak of the pandemic. Overall, I think that, I'm heartened to hear some of the stories and what people have done to try and, decrease their overall risk, within the community. We have schools that are closed. We have individuals that are working from home. We have other folks who are, practicing good social distancing, which is, staying away from other people and keeping about 6 feet space between you, one another.
You mentioned the 6 feet. The Facebook viewer had just asked that new MIT research suggests that 27 feet is a safe distance better than 6 feet. Is that recommended by the CDC, or have you heard much about that?
So it's not something that is typically seen when you're talking about the primary mode of transmission with COVID-19. What we know is that an individual, as they're talking or coughing or sneezing, every time you do that, there are little droplets that are expelled from your mouth, and they do hang in the air a little bit, which is why we go even a little bit further than arm's length when we're talking about how far some of those little droplets will travel. But it is standard that the infections like this that are primarily focused on droplet transmission, which is that droplet being the main source of spreading it, is 6 feet. What that other research might be talking a little bit about is some of the particles that can stay suspended in the air a little bit longer. That might be resulting in some of the MIT modeling that's out there, but that is not kind of the common practice.
There's a lot of talk about the shortage of supplies, and some people are making masks. And there's also talk about whether we should all be wearing masks when we go out into public. How do you feel about all the masks? What would you recommend everyone wear, though?
So I think it's important to remember that, why do we have masks? And the important part is that individuals in the community, are not really helped by most of the masks that are used in healthcare. We have specific masks called N95s that are actually respirator masks, and those are designed and needed to be fitted to a person's face and are most often used by healthcare professionals. There are other that are surgical masks that simply provide a barrier between somebody that might be ill and yourself. And there are particles that potentially can work this way around the mask as you're breathing in and out. So you need to think about it as just a simple barrier, really, to help avoid some of those small droplets, that might be expelled from somebody as they're coughing or sneezing from getting into your mouth. But overall, the general consensus is that, masks are not used widely because they really do need to be reserved for healthcare professionals and for ill patients.
And it would seem the safest thing is to stay home.
That's definitely true. Whether you're talking about staying at home because you are showing symptoms, or whether you're talking about staying at home and practicing social distancing, both of which are very effective at helping prevent illness.
Thank you. Well, today's COVID...
1919, they came and went with a great deal of speed. Another one is the geographic differential, that it didn't hit every place in the state in the same way, and I'm sure there's a lot more research that could be done on that. Another is the slowness with which some public officials figured out what was going on and what to do. And that took a while for it to sink in, and once it sank in, it was almost too late. These kinds of things, the mysteriousness of the whole thing, how little was known then and even today about why it arose so quickly and why it disappeared so quickly. Then you think about, as the first explorers and travelers, fur traders up the Missouri River came, they brought their diseases with them and infected a lot of the Indian tribes, which killed as many as half or more of them in a short period of time. There were also the cholera epidemics of the 1830s and 1850s and 1810s that would have had some effect or other, but it's hard to know because there really aren't many written records about that in the area. One thing that needs to be said is that there's been very little written about this. The standard textbook on South Dakota history, Herbert Shell, has nothing about the flu epidemic. Robert Carl Levitz tells us that the Spanish flu killed 1,093 people, according to the State Board of Health. Well, as a historian, we always like to think that there are lessons to be learned from history. I think just paying attention, being aware, and using our imaginations to think about what the possibilities are, and perhaps getting prepared for things so that we know how to react when they occur.